You know that moment when your dog, who usually leaps onto the couch without a second thought, suddenly hesitates?
Hmm.
Or maybe you've noticed a slight limp after their walk, or even had a few unexpected accidents inside.
Yeah, those little changes.
As dog owners, our ears perk up at any of these things, right? And often they can be the first whispers of something going on in their lower back.
That's right. And that's exactly what we're diving into today. We're going to unpack canine lumbosacral stenosis and Cauda equina syndrome.
Okay.
Now, these aren't just isolated problems. Think of them as a cluster of related issues, really, that can impact a dog's mobility and comfort in that crucial lower back region.
Okay. Lumbosacral stenosis and Cauda equina syndrome. It sounds a bit complex, but our mission for you today is to try and make it crystal clear.
Yeah, break it down.
We want to explain what these terms actually mean in plain language, what can set them in motion, how your vet figures it all out, and most importantly, what the options are for helping your dog. By the end of this, you'll hopefully have a much better understanding and feel more empowered if you ever hear these terms or, heaven forbid, encounter these issues.
Precisely. We're drawing directly from veterinary medical information to give you a solid but still easy to grasp overview, cutting through some of the technical jargon so you can really understand what's happening.
Okay, good. So let's get down to it. What exactly is lumbosacral stenosis?
So at its heart, stenosis just means narrowing. Simple as that.
Okay.
In this case, we're talking about a narrowing of the spinal canal way down in the lower back. That's the lumbosacral region. And sometimes even the little doorways, the foramina, where nerves exit the spine in that area,
Ah, okay.
particularly around the last lumbar vertebra, L7, and the sacrum, which connects to the pelvis.
Yeah.
The key thing really is that this shrinking space puts pressure on the delicate nerves inside.
And that pressure is what then leads to Cauda equina syndrome. Tell us more about that connection.
Yeah, think of Cauda equina syndrome as the collection of signs and symptoms. The pain, the weakness that pop up because those nerves are being squeezed.
Right.
The name itself, Cauda equina, it's Latin for horse's tail.
Huh. Okay.
And it's actually a pretty good description of how these nerves look as they fan out from the end of the spinal cord down there. So the pain, the weakness, all those other issues we see, they're a direct result of those individual nerve threads in the horse's tail getting compressed.
Okay, so we have this narrowing acting like a bottleneck, putting pressure on those nerves, and that then causes all these downstream effects we call Cauda equina syndrome.
Got it.
Mm.
Now, how does this narrowing actually happen in the first place? What kicks this process off?
Well, there are really two main ways this can start. Either a dog is sort of born with a predisposition, which we call congenital,
Right.
or the condition develops over time due to, wear and tear, which we call acquired.
Okay, let's start with the congenital side. What kind of inborn factors are we talking about? So some dogs are just born with subtle differences in the shape or alignment of their vertebrae down there. A common thing we see is something called a transitional vertebra.
Transitional.
Yeah, it's like a vertebra that's kind of trying to be two different types at once. It takes on characteristics of the bones above and below it.
I see.
And these slight malformations can mean a dog starts life with a naturally narrower spinal canal, or maybe the area is just more vulnerable to problems developing later on, sometimes even pretty early in life.
Interesting.
And what's fascinating is that these congenital issues seem to pop up more often in small to medium-sized dogs. Border Collies are one breed where we definitely see this predisposition.
Good to know.
And these cases often become noticeable when the dogs are, say, between 3 and 8 years old.
That's really interesting, especially for owners of those breeds. Now, what about the acquired causes? You said that's more common.
It is, yeah. It's generally more common. Acquired lumbosacral stenosis typically develops as the structures in the lower back just experience the normal wear and tear of life.
Makes sense.
The most frequent culprit here is degenerative changes in that disc between the last lumbar vertebra, L7, and the first sacral one, S1.
The disc itself.
Right. As this disc wears down, it can bulge or even herniate, basically shrinking the space available for the nerves.
Okay.
There's also a specific condition called sacral osteochondrosis dissecans, OCD, that we sometimes see in young German Shepherds, usually around a year old. That's a cartilage development issue.
Right, I've heard of OCD in other joints.
Exactly. But generally speaking, acquired cases are more prevalent in medium to large breed dogs. We often see it in breeds like German Shepherds, Boxers, Rottweilers.
The bigger, active dogs.
Yeah, often. And the typical age of onset is around 6 or 7 years old. Oh, and interestingly, it seems to affect males a bit more often.
Huh. Okay, so whether it's something they're predisposed to or something that develops, the end result is this squeezing of those crucial nerves. What kinds of signs might an owner start to notice?
Pain is often the first red flag. You might see your dog showing this lumbosacral pain in a few ways. Maybe they hesitate before jumping onto their favorite spot, or they're reluctant to tackle stairs, or they just seem a bit stiff or uncomfortable during walks.
Little things like that.
Exactly. And veterinarians often check for this specific pain by gently pressing on the lower back or by carefully extending their hip joints that can sometimes trigger a pain response if this area is inflamed.
That makes sense. What other changes, maybe in their abilities, might an owner see?
Well, because those L7 and sacral nerves are crucial for controlling the hind legs.
Right.
When they're not working properly due to that compression, it can lead to lameness in the back legs. It might start subtly, a slight hitch in their step,
Yeah.
but it can progress to more noticeable weakness, maybe a decrease in muscle mass in their hindquarters, and even problems with their reflexes and their overall balance. They might seem a bit wobbly.
And I can imagine issues with bladder and bowel control would be incredibly concerning for any owner.
Absolutely. Urinary and/or fecal incontinence can unfortunately occur. That's due to dysfunction of the S1 to S3 nerves, which play a big role there.
Oh, wow.
This can be really distressing, obviously, for both the dog and the owner, and it's definitely a significant sign that needs veterinary attention right away.
Definitely. What about their tail? Can that be affected too?
Yes, it can. The caudal nerves control the tail, so you might observe changes in how your dog typically holds their tail. Maybe it hangs low or they don't wag it as much.
Okay.
Or you might even notice weakness in the tail, or in more severe cases like a complete inability to move it, tail paralysis.
That's quite a range of signs. Are there any other, maybe less obvious things owners should look out for?
Sometimes, yeah, particularly in dogs with congenital issues, or if there's active inflammation irritating the nerves, they might develop this habit of excessively licking or chewing at their lower back or tail area.
Ah, self-trauma.
Exactly.
Hmm.
This can lead to skin lesions, and it's often a sign of that underlying nerve discomfort or pain. They're trying to tell you something's wrong.
Okay, so we've covered what it is, what it looks like. Let's dig a little deeper into the why. What are the specific things actually causing this nerve compression?
Right, the mechanisms, we've already touched on those inborn vertebral malformations, like transitional vertebrae and that OCD condition.
Mm-hmm.
But another really significant cause is intervertebral disc herniation. Remember those cushions between the vertebrae?
And the discs.
They can either rupture suddenly, that's a type I herniation, more acute, or they can sort of degenerate and bulge more gradually over time, a chronic type 2 herniation.
Yeah.
Both can really put the squeeze on the spinal cord and nerve roots there.
And it's not just the disc itself that can cause trouble, is it?
That's absolutely correct. There's a ligament that runs along the top inside the spinal canal, connecting the bony arches of the vertebrae. It's called the interarcuate ligament.
Okay.
Sometimes this ligament can thicken up over time. We call it hypertrophy or hyperplasia. And that extra tissue can also contribute to narrowing the space.
Oh.
Similarly, the small joints on the back of the vertebrae, the articular facets, those, along with the soft tissues around them, can sometimes proliferate or enlarge, again, leading to compression.
Wow, lots of moving parts.
And in some instances, there can even be a partial slipping or dislocation that's subluxation right at that lumbosacral junction itself.
It really sounds like there are quite a few ways that this delicate area can run into trouble.
There certainly are. And it's really, really important to remember that things like inflammation or even cancerous growths within the spinal canal can sometimes mimic these signs,
Right.
which is exactly why getting an accurate diagnosis from your vet is so critical. You need to know what you're truly dealing with.
So are there particular breeds or other factors that put certain dogs at higher risk? We mentioned German Shepherds.
Yeah, it's worth repeating. The German Shepherds who have those lumbosacral transitional vertebrae do seem to have a significantly higher chance of developing the syndrome.
Why is that, do you think?
Well, the thinking is it might not just be the altered shape itself, but maybe also related to the breed's typical way of moving, their gait,
Oh.
and the sort of repetitive stresses placed on that specific area over time. It makes that congenital variation perhaps a more significant risk factor for them.
Okay, so a dog owner suspects something might be amiss. They go to the vet. How does the vet actually diagnose this? What's involved in figuring it out?
Well, the diagnostic process usually starts by carefully ruling out other conditions that can look similar. That's the differential diagnosis part.
Look at what kind of things?
Things like hip dysplasia, which is very common, or injuries to the iliopsoas muscle group in the hip area, uh, chronic spinal infections like discospondylitis,
Okay.
even bone infections, tumors, fractures, other kinds of nerve problems.
Yeah.
They all need to be considered. So a really thorough physical exam, including both orthopedic and neurological checks, is the absolutely critical first step.
And then imaging, I assume.
Then usually imaging, yes.
Yes.
But what about standard blood and urine tests? Do those help?
Good question. In most straightforward cases of just lumbosacral stenosis, routine blood work and urinalysis will probably come back normal.
Okay.
However, if a dog is experiencing that urinary incontinence we mentioned, urinalysis might show a secondary urinary tract infection, which is common. And if the vet suspects something like a spinal infection, discospondylitis, then blood tests might show certain inflammatory markers. So they're not diagnostic for the stenosis itself, but they give important supporting info and help rule out other stuff.
Makes sense. And what if the vet is worried about inflammation or infection based on the signs or initial tests?
If those concerns are high, then a cerebrospinal fluid analysis, CSF tap or spinal tap might be recommended.
Okay.
That lets us examine the fluid around the brain and spinal cord for evidence of inflammation, infection, or even cancerous cells.
Got it. Now, imaging, we keep coming back to it. What types are most helpful here? X-rays first.
Often, yes. Radiology or x-rays are usually the first line because they're readily available, relatively inexpensive. They can sometimes show changes like arthritis at that lumbosacral joint, maybe a narrowing of the disc space between L7 and S1, or even a subtle misalignment of the sacrum.
But, I sense a but.
There's a big but. It's really important to interpret x-ray findings cautiously because many of those exact same changes can be present in dogs who have absolutely no clinical signs. They're just incidental findings sometimes.
Okay. So X-rays give clues, but not the whole story.
Exactly. For a much more detailed look at both the bones and the soft tissues, like those discs and ligaments we talked about,
Yeah.
CT scans and MRI are the preferred, more advanced imaging methods. They let us actually visualize the spinal canal and the nerve roots directly and pinpoint areas of compression.
That sounds much more definitive.
It is, but even then, just like with x-rays, the findings on CT or MRI need to be carefully correlated with the dog's actual symptoms. You can sometimes see abnormalities on an MRI in a dog that feels perfectly fine.
Right. Treat the patient, not just the scan.
Precisely.
Are there any tests that directly check how well the nerves themselves are working?
Yes, there are. Electromyography, or EMG, is one. It detects electrical activity in the muscles.
How does that help here?
Well, in the context of lumbosacral stenosis, an EMG can help identify signs of nerve damage, we call it denervation, in the muscles supplied by those L7 to caudal nerves. So it helps confirm the location of the nerve problem,
Okay.
but it doesn't necessarily tell you the cause of the compression.
I see. Any others?
Yeah, there are also nerve conduction studies. These measure how quickly electrical signals travel along nerves, like the sciatic tibial nerve pathway. Things like F-wave latencies can also give us valuable information about nerve function in that area.
Okay, complex stuff. So when a vet puts all this together, the history, the exam, blood work, maybe the imaging, maybe these nerve tests, what are the common problems they actually find? What's the pathology?
The specific pathologic findings can vary, of course, but common things include bulging of that L7-S1 disc pushing up into the canal, thickening of that interarcuate ligament we mentioned, narrowing of the little holes, the foramina where the L7 nerves exit, maybe due to soft tissue or bony overgrowth. That downward displacement or slipping of the sacrum, enlargement of those facet joints with thickening of the capsule around them.
So various forms of narrowing and pressure.
Exactly. And in congenital cases, you might see actual malformations of the vertebrae themselves, not just transitional ones. And again, always have to keep in mind the underlying cause could still be a tumor, inflammation, or an infection mimicking stenosis.
Okay, so that you've got a good handle on what it is, how it happens, the signs, causes, risks, and the whole diagnostic journey. Now, for the big question, what can actually be done to help a dog suffering from this? What are the treatment options?
Right, the management. Treatment strategies really depend on how severe things are and the specific symptoms the dog is showing.
Okay.
If a dog is having trouble with, say, urinary incontinence, the initial approach might even involve hospitalization for a bit.
Why is that?
To help manage the bladder, maybe manually expressing it regularly or using a catheter temporarily, and also to monitor closely for and treat any secondary urinary tract infections, which are a risk.
Okay, that makes sense for severe cases. What about ongoing care at home?
At home, managing incontinence, if it's present, often involves the owner learning how to manually express the dog's bladder gently or just maintaining really careful hygiene to prevent skin scald or infections.
Right.
And activity management is absolutely key.
How so?
For dogs being managed without surgery conservatively, this usually means strict rest, only short, controlled leash walks. No jumping, no rough play.
Okay.
This is often combined with medications to manage pain and reduce inflammation. Sometimes epidural injections of corticosteroids right into that lumbosacral space can be used too for more targeted relief.
Does it usually work?
It can be very effective at managing symptoms. But it's really important for owners to understand that the signs might well come back if the dog ramps up their activity level again. It's management, not always a cure.
Got it. And what if surgery is the chosen route?
If surgery is performed, there's usually a significant recovery period afterward, maybe 6 to 12 weeks, where activity still needs to be really restricted.
Okay.
Then it's a gradual, carefully controlled return to normal activity. And diet plays a role too. Keeping the dog at a healthy weight is crucial to minimize stress on the whole spine.
Always important, but especially here.
Definitely. And I would imagine keeping owners well informed throughout is vital.
Oh, absolutely. Client education is huge.
Mhm.
Owners need to understand the potential for the condition to progress,
Mhm.
you know, worsening weakness, more incontinence, maybe tail paralysis.
Setting realistic expectations.
Exactly. And explaining that the lameness or any self-licking is often directly from nerve pain and compression, not just, soreness. Surgery is often considered for dogs with severe, really intractable pain or significant nerve deficits.
Especially the incontinence.
Especially incontinence, yeah, as that can be harder to reverse with just medical management. But for milder cases, medical management alone can often be quite successful.
You mentioned surgical options briefly. What do those typically involve, just generally?
Sure. There are several techniques,
Yeah.
and the best one depends on exactly what the imaging shows is causing the compression. Common options include a dorsal laminectomy.
Which is?
That's where a portion of the bony roof of the vertebra is removed to give the spinal cord and nerves more room. Decompression.
Okay.
There's also lateral foraminotomy, which focuses on widening those little exit holes, the foramina, for the nerves.
Right.
And sometimes a fixation fusion procedure might be done to stabilize the lumbosacral junction, especially if there's clear instability.
Okay. And the medications used, what are the mainstays?
Commonly, non-steroidal anti-inflammatory drugs,
Mm.
NSAIDs like carprofen, meloxicam, those sorts of things, they help with pain and inflammation.
Standard stuff.
Pretty standard, yeah. Gabapentin is another one used very frequently
Why gabapentin specifically?
because it's particularly good at targeting nerve pain, neuropathic pain.
Hmm?
A common side effect can be some sedation, so the dose is usually adjusted carefully for each dog. And as I mentioned, sometimes those epidural injections of corticosteroids, like methylprednisolone acetate, are used to deliver anti-inflammatory medication right to the source of the problem.
So definitely a range of treatment options. What about the long-term outlook? What's the prognosis typically like?
The long-term prognosis really hinges on how severe the nerve damage is when diagnosis happens and treatment starts. Earlier is generally better.
Makes sense.
And owners need to be aware of potential complications. Things like continued progression of the neurological signs despite treatment. Sometimes fluid pockets called seromas can form your surgical site.
Okay.
Scar tissue forming around the nerves after surgery, which can cause issues later. Recurrence of signs is possible after either medical or surgical treatment. If implants are used in surgery, there are potential issues with those. Very rarely, fracture during surgery or infection.
Those certainly sound like important things to be aware of, potential downsides.
They are, definitely.
Mm-hmm.
But it's also really important to emphasize that many, many dogs can be managed quite successfully,
That's good to hear.
especially with consistent medical treatment. Though, the level of recovery needs to align with what the dog needs for its lifestyle. For surgery, it often provides a good prognosis for dogs whose main issue is low back pain and maybe only mild nerve deficits, maybe 70 to 80%, achieve an excellent or good long-term outcome.
That's pretty good odds.
It is. Unfortunately, the prognosis tends to be more guarded, more uncertain for dogs who already have significant fecal and urinary incontinence before treatment starts. That can be tough to reverse fully.
Right. So it's definitely a complex picture, but there are absolutely ways to help dogs who are dealing with these issues.
Absolutely. There's hope and options.
Okay, great. To kind of bring everything together then, let's recap the key takeaways from our deep dive today. Lumbosacral stenosis and Cauda equina syndrome. They're really a collection of related problems affecting a dog's lower back and those critical nerves there.
Yep, the horse's tail nerves.
Right. There are various underlying causes, things they can be born with, things that develop over time, leading to a whole range of signs impacting movement, bladder bowel control, even their tail. Getting a diagnosis involves a thorough vet workup and often relies on advanced imaging like CT or MRI to really see what's going on under the hood.
Crucial step, that imaging.
And the good news is that both medical and surgical treatments are available. While there can be potential complications, many dogs can go on to live happy, comfortable lives with the right management plan.
That's a fantastic summary.
Yeah.
And if you, our listener, have noticed any of the signs we've discussed today in your own dog, that hesitation, the lameness, the accidents,
Yeah.
it's natural to feel concerned, of course. But the most important first step is just schedule that consultation with your veterinarian. Don't wait.
Right.
Early diagnosis and getting a well-thought-out management plan going can truly make a significant positive difference to your dog's comfort and their overall quality of life.
Well, exactly. And it really makes you appreciate, doesn't it, just how this intricate network of nerves back there, this horse's tail, plays such a delicate yet absolutely vital role in everything a dog does.
It really does. The wiring is complex.
It prompts you to think, what other seemingly small anatomical changes in our animal companions could potentially have such widespread and significant effects on their well-being. Definitely something to ponder as we marvel at how these amazing animals are put together.